Care project on the healthcare in the Netherlands. I'm Danielle.
I'm Shannon.
I'm Noria.
I'm Sabrina.
So our first slide is about cultural considerations. Turkish and Moroccan labor migrants were among the first to suffer from the economic decline of the 1970s, and Turks and Moroccans remain the most disadvantaged ethnic groups in the Dutch society. Much attention is given to fostering a sense of community by creating public spaces such as parks and squares with benches and playgrounds. Food is seen as a necessary part of life with no need for luxury. Traditional foods include pea soup, kale stew, hodgepodge, a thick stew, white asparagus, French fries with mayonnaise, meat croquettes, and raw herring. It's a very liberal country. It allows the sales of soft drugs and open prostitution in red light districts. Dutch women lag behind men in terms of income and job status, making half as much as men on average. They highly value equality, though. For example, people use the formal you when speaking to everyone. The country also has an intricate network of railroads and an even denser web of bicycle paths. The Netherlands has a population of 15 million in 2000. It's the most densely populated country in Europe, with 1,196 inhabitants per square mile. Low-income households are concentrated in the Randstad cities and the two most northern provinces, which you can see on this map.
Even though the Netherlands is not a large country, it has the 16th largest economy in the world and the 6th largest in the European Union. The Netherlands is known for its highly open and free economy, meaning that there's very little government restriction, and it is typically entails support for highly competitive markets and private ownership of productive enterprises. And it was ranked the 17th freest economy in the world at the beginning of 2015. The Netherlands' high level of trade with other countries is very significant, making it the 5th largest exporter of goods in the world, so it occupies a very prominent position in world trade. However, over the past 5 years, the Netherlands' openness to global commerce and economic freedom has been under stress due to increased government spending, high taxes, and perceived corruption.
The Health Insurance Act was passed in 2006 and was immediately put into effect January 1st of that year. It requires all people legally living or working in the Netherlands to buy health insurance from a private insurance company. In 2006, 98.5% of people purchased health insurance. The country's health care is paid for through general taxes, and everyone older than 18 years has to pay a premium to his or her chosen insurer. Independer is a website that allows the Dutch people to compare and contrast 14 different health insurance companies that best fits their needs. If someone is unsure about what plan they need, you can take a survey and it will calculate your answers and show you the best plan for you based off the survey answers. Another health insurance plan is the Atlas Travel Plan for international students. Students who are studying abroad, working, or participating in an internship have to get insurance. Below are 10 options for health insurance and their benefits.
Government expenditure made up 80% of the Netherlands' healthcare spending in 2006, according to the World Health Organization. The Netherlands spend just 9% of GDP on healthcare, compared to the US's 16%. The standard insurance in this country is financed by a mixture of income-related contributions and flat premiums. So healthcare is largely paid for by employers and by individual premiums. Employers pay an income-related contribution of 6.5% of their employees' pay. Of the total health fund, about 50% is paid for through employee benefit, 5% through government contributions, and the remaining amount is covered by individual premiums. Most people pay about $1,000 to $2,000 in premiums, while children up to the age of 18 are covered for free. And those who cannot afford to pay the premium are subsidized by the government.
By law, everyone in the Netherlands is entitled to health insurance. And the higher an individual's income, the less benefits they receive. You can always purchase an additional health care coverage, but the basics are determined by the government. The basic health care includes medical care provided by hospitals, medical specialists, general practices, and midwives, medication, medical equipment and devices, paramedical treatments including exercise therapy, physiotherapy, occupational therapy, speech therapy, dietary and nutritional services, paramedical treatment, dental, which is free up to the age of 22, can also include advanced dentistry and dentures, patient transport, hospital stays, maternity care, and a maximum of 3 in vitro fertilization treatments. Next, we're going to discuss the primary care system. 95% of care in the Netherlands is primary care, and family practitioners are actively involved in all subsequent care for the individual. So family practitioners are the first contact an individual has into the healthcare system. They must refer individuals to specialists or to the hospital. In order to refer people to the hospital at all times, there are after-hour care consortiums, which family practitioners take turns working night shifts to see all patients. Family practitioners also have panels, which are groups of 200, 2,000 to 200 or to 2,500 people that they are responsible for. They actively monitor these people, and it's based on geography. This is to address care and prevention needs of individual communities. Payment is the insurance acts as patient advocates, so they're on the side of the patient, but they do make sure that the family care practitioner receives their pay. And this is done through a flat rate premium, income contribution, and a 30% service fee.
The Netherlands has been rated as one of the top 5 countries to grow old in. The number of people over 65 is expected to rise by 70% between 2010 and 2040. In-home care is a big staple of senior care, but the Netherlands also has opened a lot of community living, which has made it more possible for elderly people to live on their own. In fact, around 95% of the elderly in the Netherlands live on their own. Seniors with Alzheimer's have the option of living in an Alzheimer's village, also called a dementia village, where caretakers are staffed at restaurants and stores to make sure they're okay at all times. Veterans with emotional or physical problems call a number which is part of the National Care System for Veterans. Veterans can choose between going to a military care or civilian care organization. They would probably go to a military care organization for PTSD rather than a civilian care organization because they would probably be able to relate to the patient more or see more cases and know how to deal with it. If the veteran is disabled from employment, they're eligible for a one-off special benefit, also known as a debt of honor, which is when the defense organization gives an amount of money to cover medical costs that ranges from approximately $6,800 to $136,000 US. TRICARE Standard Overseas is a website that asks what country you're living in, military status, and rank. You have to be registered in the Defense Enrollment Eligibility Reporting System to be eligible for discounted deductibles, which are shown below.
Thank you for watching.